Welcome, everyone, back to another episode of the Parkinson's Policy Podcast, where we advocate together to raise awareness and advance meaningful policy for the Parkinson's community. From Washington, D.C., straight from the U.S. Capitol and beyond, we bring together senators, representatives from states, researchers, and advocates to amplify the voices of people living with Parkinson's and their caregivers. My name is Dr. George Ackerman, Sharon's son, founder of TogetherForSharon.com, joined by my amazing co-host, Margaret Preston, president of Power Over Parkinson's, and we just want to welcome you back to another episode.
Thank you so much, George. I'm pleased to be able to introduce our next guest, Representative Jennifer O'Mara, who was elected to represent the 165th Legislative District on November 6th of 2018. Jennifer believes there is more that unites us than divides us. Amen to that. And is committed to being part of a government that serves the people. As state representative, Jennifer is committed to improving public education for children, protecting communities from the dangers of gun violence, ensuring access to affordable health care, and expanding job opportunities at all skill levels. Her dedication to public service is deeply rooted in her own experience, and her ability to deliver practical solutions has been shaped by her challenging personal journey. Prior to joining the state legislature, Jennifer was employed for almost 7 years at the University of Pennsylvania. She served as the assistant director of university stewardship, working alongside her colleagues to ensure that attending the university is affordable for all students. She currently serves on the Transportation, Labor and Industry, Veterans Affairs, and Emergency Preparedness and Education Committees, as well as chair of the Southeast House Democratic Caucus delegation. She's also a member of Pennsylvania Higher Education Assistant Agency Board. Representative O'Mara, I think it's fair to say you're quite busy, and we appreciate your time with us on our podcast.
Thank you so much. I'm happy to be here and appreciate the invitation.
Absolutely.
One thing we love about the show is we get to hear from representatives throughout the country. I'm located in Florida, and Margaret is in also different states, but it's important to have a voice from everyone, not just our residency. And it's an honor to have you with us. We were wondering if we could start with what encouraged you to get into this line of work, but specifically to work in the Parkinson's field, really on the power quad, which we'll get to shortly.
So thank you. I appreciate the question. I try to, as a legislator, work on issues that either I was informed by my own experience or by constituents. And most advocacy around Parkinson's or any sort of disease-related advocacy has been brought to me from my constituents, although I did lose my godfather, who was very important to me, to Parkinson's disease. But specifically when it came to the power quad issue, that was Representative Natalie Mihalik, who I understand was on this podcast before. She is a member in the state house in Pennsylvania as well. She's from Allegheny County. I'm from Delaware County, opposite side of the state. We also sit on opposite sides of the aisle. Not that it matters, but I do think it's important to demonstrate that there is an ability for us to work together. And Natalie came to me. I think because I'm a new mom again, I have 2 little ones now. We've been really trying to focus on public health and how clean air and clean water and a clean environment impacts our health, our physical health. And she presented this bill to me and asked if I'd be interested to help to work with her on this package of bills around food. And because as parents, we've just been shocked at what we learn our children are eating and exposed to constantly. But I think as millennial parents, we're most disturbed to think about, if we're thinking about how it's impacted them, it's impacted us. And the data is showing that, right? So I was really excited to join Rep. Mihalik on this package of bills, and honestly, truly didn't understand the connection to Parkinson's until she brought this topic to me. But given what happened to my godfather, it felt really kismet that this would be something that I started working on.
Thank you. And we send our love and support to you and the family. We always hope that we never forget anyone who lost their battle, like my mother, due to Parkinson's. And if there's not a better reason, a lot of time we don't talk because we're talking about people diagnosed today and their families, but the children. You know, I look at my three and wonder if we don't do something like we're doing through this conversation, and Margaret's family and children, that we're, you know, sending our children to have to deal with this, and that can happen. So thank you. As we shift specifically to Pennsylvania now, uh, what can Pennsylvania do to ensure equitable access, which is an area I believe you're strongly for and working with, to Parkinson's care across both urban and rural regions? Because sometimes, as you know as well, some individuals might not even know they have Parkinson's because they just can't find a doctor to help diagnose them.
Yeah, I mean, Pennsylvania is one of those, it is a state where we are really struggling with healthcare deserts, and that is impacting people all over the Commonwealth, but really especially in rural parts of the state. So, you know, as a legislator, we have been working on trying to mitigate the impact that private equity has had on our healthcare system, because that is what has, in our state at least, led to the decline of hospitals and primary care and specialty care and mental health care in rural parts of the state. And so we are pushing legislation that will address that. Also, frankly, we're pushing mass transit funding legislation, because I don't know if a lot of we're trying to educate my colleagues to help them understand that mass transit is in all parts of the Commonwealth. It might look like trains and subways in Philadelphia, but in rural Pennsylvania, it's buses that take people to doctor's appointments. My godfather, who I mentioned, he lived in Chester County, in a rural part of Chester County, and needed to get transportation to the VA in order to get treated for Parkinson's. He was really lucky that he was in the VA and qualified for support as a veteran. But we need to make sure everybody has that, right? And so I am definitely pushing for funding our Medicaid programs, funding our Medicare programs, funding mass transit, funding research. Research is really important when it comes to treating diseases like Parkinson's and others. And so as a legislator, that's what I can do. As a Pennsylvanian, I think it's really important to remind people to advocate with your state representatives and your state senators. You don't just need to send an email, but make a phone call, ask for a meeting. The most impactful meetings I've had is when constituents come in front of me and share their personal stories and help educate me on a topic I may not have known about. And that has led me to working on legislation. So you need to continue to do that. We legislators in every state, so this isn't just true for Pennsylvania, but we will take action when we are confronted with the problem. And so if you are being impacted by Parkinson's disease, or really any health issue that is not getting the proper attention it needs, you need to get out there and share your story and get in front of the people that are making the decisions.
Yeah. Thank you so much. I think, as I've said in prior interviews, your ability to articulate and other lawmakers' ability to articulate the ease in which folks can and should feel comfortable reaching out to their lawmakers and kind of setting that stage of education awareness is so important. So thank you for breaking that down and making it tangible. I wanted to move on to the bill that it would ban paraquat in Pennsylvania, HB 2065. You're co-sponsoring it with Rep. Mihalik, as you noted. I understand you did find out about paraquat and its connectivity to Parkinson's from Rep. Mihalik, but share with us what would you do to encourage other lawmakers who don't know a lot about paraquat and how to learn about it, why it's important, and its link to Parkinson's?
Well, thankfully, we have a great champion in Rep. Mihalik, and she has put together a caucus and actually brings resources to us, so you can read about it. I think what we're up against more in Pennsylvania isn't necessarily the legislators not understanding the issue, but it is the large lobby in the pesticide community that fights any sort of regulation on chemicals and pesticides. So because we have a large agriculture state. So we really need to, I think, bring everyone to the table, the Department of Agriculture, the Department of Health, Department of Human Services, and the legislature, and start to understand that we can't take no action because the fear of a little bit of action might impact this side of the this side of the picture when we're ignoring everything else. And I'm not just dealing with that when it comes to this legislation. And this is a part of a package of bills. Some of the other bills are directly around prohibitions on pesticide use in general and other regulations in food production. But Pennsylvania is a huge agriculture state. I'm trying to work on bills that have just give local control on some of this stuff because I live in a really dense suburb. And there's even a big push against that. So that's what we're sort of doing now, is pushing to build a coalition and bring all the stakeholders together and try to make progress in the people that are fighting us, because that's the bigger issue than there's 253 legislators. They're not all going to pay attention to this until it's scheduled for a vote or coming out of committee, right? And so that's where what we're focused on right now is just getting it to a point where we can move it out of committee without a huge wave of opposition.
Yeah, well said. As I told Rep. Mihalik, we had similar legislation here in Virginia. It's since been tabled till 2027 because of such opposition. And, it was a good first step, right? I think we set the stage and that foundation of awareness of the chemical and its linkage to Parkinson's. So it's neat to hear other states kind of going through the same thing, hopefully with a little bit more success, but kind of going through the process and laying that groundwork. So thank you for your work on that.
Yeah, it's tough because I don't believe that anyone who when we say, look, paraquats there's a link to paraquats use in causing Parkinson's. There's no denying that data. And I don't think anyone is maliciously saying, well, we're not going to stop using it because it helps us. I think there's just a fear of a slippery slope when it comes to regulation in agriculture that, once you say you can't use one chemical, it's going to lead to all these other things. But what we keep pointing to is the fact that the European Union has already successfully banned many of the chemicals that we're talking about, and they're still able to produce food, and they're still able to meet the demand of what they need. So science is a beautiful thing. Technology is advancing. We need to advance as well. And that's sort of where we're at now. But what I love so much about this group of legislators is it's really bipartisan. That's in Pennsylvania championing these bills. It's really bipartisan, and it's almost all parents. And our kids are still in front of us, right? And we're, we also have people like me who are thinking about those that we've lost. But we have living reminders in our houses every day about why this legislation is so important. And I think that's going to help keep the pedal to the metal.
Absolutely.
I'm proud of Pennsylvania and also Virginia. Unfortunately, in Florida, we have done nothing. It's another story. Thankfully, they are passing, registries and things, which is great, but not, we even brought up to a representative, and I felt bad because I think she felt like she's alone in that, and hope we'll join. And that's what we hope too, not just through the show, but that once we see the incredible work that Pennsylvania is really leading the way, Virginia is trying to join them, and it's catching on that, states like mine will join, because we are also, obviously huge with agriculture, even though it seems they're wiping out all the grass in my community and putting buildings and homes and apartments. But that's for a different show. So you actually mentioned something that's rare. In our show, it's not rare because we've been saying it a lot, but how important it is that this is not a partisan or issue, that it's not one-sided. It has to be everyone together, whatever your beliefs, theories, and things are, because I just am still shocked, as you said, other countries banning it, and we're just one that's just waiting on something. So hopefully this will, what you're doing too, the work will push this over, and I hope the media will join in and show how important it is nationally. But how can additional bipartisan efforts be strengthened to also prioritize funding for Parkinson's research and support? So kind of the other side, we fight for the banning the toxin, but also, a lot of unfortunate federally, the budgets have been cut lately for research towards a cure.
So that's where the advocacy is so important, because budgets are going to be tough this year. I kind of keep saying to everyone, because of the situation that the states have been put in by the federal government, we're in a situation where we're deciding not if we will make cuts, but what we will make cuts to. And that's a really hard place to be in when we're already hearing about the economy and rising costs for people and more people needing government support, right? So the advocacy is so important, making sure that you have you're meeting with legislators, you have people in, I'm sure this is the national network, but there's a Pennsylvania chapter, I imagine. Have your Pennsylvania folks meeting and talking with their representatives during the budget season, which is now until July when it finally passes, hopefully June, but probably July. And it's when those personal stories matter. And another colleague I want to shout out, Representative Kyle Mullins. Now, he hasn't been focused on Parkinson's, but he has been focused on ALS because he's very publicly talked about losing his father to ALS. And he has worked with a coalition of stakeholders to get genetic testing funding passed and research funding passed in the last budget. And he built that bipartisan coalition, bicameral coalition. He kind of demonstrated how it can be done. So the playbook is there, and we just have to follow it. But be persistent. Persistence is really key when it comes to budgets and making sure that everyone is thinking about what your needs are when they're deciding what they're spending money on.
Definitely. And we were fortunate enough to talk to Representative Mullins as well, and his work that he's done. And as you said, he's laid out the playbook for hopefully things we can do with other neurodegenerative diseases to support research for, therapeutics, even care partner support programs as well, and care partner exhaustion. So there's so many components of it, and we're appreciative of you kind of seeing, not recreating the wheel sometimes, right? Seeing what's been done and saying, well, how could we do this here? And I appreciate that simplicity.
100%. I mean, as a state legislator, one of the things I love is connecting with state legislators from all over the country. Every state is different. We all have different makeups of our representative bodies, but most of us work on similar policies. Yeah. So, I have a text group that I'm in with state reps from North Carolina, Georgia, Michigan, Arizona. And whenever I need something or an idea, I'm like, hey, I just asked them, has anyone started working on this? And just recently, I passed a bill that will help everybody, including those that have Parkinson's, paid filing leave, House Bill 200. It would create, it's called the Family Care Act, but it would create a 12-week paid program for paid leave if you're taking care of yourself, a loved one, having a child, recovering from violence. It's a wide gamut. And after that passed, the text lit up with someone from Michigan asking for legislation and messaging. So we have the ability to network, and I have learned to not reinvent the wheel, learn from what other states have done. It's also great. The state model allows us to see, when a state does something, if they don't do it right, what corrections can we make to get it done? So perhaps tell your Virginia legislators to reach out to us if we can get it over the finish line and we can work with them.
I just might do that. So we can get ours to the finish line as well. I wanted to talk a little bit about what we experienced in Virginia, the opposition, right? So what would you tell those in opposition? What we saw was our farmers across the Commonwealth, our Commonwealth here in Virginia, come in droves to talk on behalf of their experience and why we shouldn't ban paraquat. So what would you tell the opposition in terms of the importance of banning this one chemical and its impact on community health?
I have found that presenting data and presenting data isn't really the way to go to move hearts. You have to share personal stories and drive out the empathy. And so I would, of course, have the reports ready and the data ready to present, but I would want to have family members and children of those who died from Parkinson's there to talk about their story. But this is, though, one of those topics where I found also that banding together is more successful. So I would at that kind of, because I've had discussions where you literally bring all the pro and all the against people in a room, and you nail it out, and they're really emotional. They can be really hard. But that's where coalition building is important. So I would suggest also partnering with those working on other neurodegenerative diseases, and or even other chemical bans. And the most important thing is offer an alternative that is actually plausible, right? So if we're telling you we don't want you to use paraquat, we need to tell you what you can use. And I think providing reasonable alternatives is something that's important when you're talking about a farmer who's worried about their bottom line.
Definitely. Thank you.
Well, as we wrap up today, I wanted to also ask, what was your grandfather's name?
My godfather, he was my dad's best friend. His name was Harry Milnick.
Well, we'll make sure that
And he, sadly, we're around the year anniversary of when he passed away.
Sorry to hear that, but we'll make sure Harry's never forgotten, as anyone who lost their battle should always be remembered, in my view. And, we again send our love and support to your family, and he'll
Thank you.
live on through this show, I think, forever.
Thank you so much.
Also, feel free to have, and everyone listening, any of your legislators reach out to us too, because I know you're speaking with people all over the country. We'd love to have them also discuss this topic in their state. But I just wanted to wrap up with, if you could leave the Parkinson's community, and specifically Pennsylvania today, with some words of encouragement, what would they be?
I think it would be to know that you're not alone. There are legislators, there are advocates, there are neighbors who understand what you're going through and who are working every single day to make it better. And that until we find a cure, we're going to keep fighting to do that.
Thank you. I'm going to send the show to Margaret to wrap up.
Yeah. Well, Representative O'Mara, thank you so much for sharing your time with us. Thank you for the good work you're doing in Pennsylvania and supporting what we too believe is a bipartisan issue, and helping educate really, this show touches folks around the country, hopefully instilling a little sense of advocacy in our listeners so they can reach out to their representatives to start such talks as well. So I know your godfather would certainly be proud of you and what you're doing, because it needs to be done. We're not seeing the action that we want at the federal level. So the state level is where it's at right now. And we're thankful for your action and your ability to call folks to take action and advocate for the disease and a healthy environment. So thank you.
Of course. Thank you so much. I really appreciate the opportunity.
Thank you also, Representative. And of course, thank you, Margaret, for the work you're doing, tireless, and Adam and everyone behind the scenes. This has been another episode of Parkinson's Policy Podcast, where we advocate together, state by state, to raise awareness and advance meaningful policy for the Parkinson's community. We're grateful for your time, Representative, and everyone listening's time. Please share the show, but even more important than that, contact your own representatives in your states and let them know we need to ban paraquat. We need to support our Parkinson's community by giving more resources and so much more. And as I always say, there's still so much more to come from our show, because we still have work to be done. And you can be sure the representative, Margaret, and myself will be fighting right by your side. So thank you all, and we'll see you soon. Thanks.
Thank you.